Good morning there, Lynn Cox, Clinical Hypnotherapist. Wanted to continue on this chat about this book review that I'm doing, Bad Therapy by Abigail Shrier. This is a very well-researched book talking all about therapy. Why do we have so much therapy these days? Why isn't it working? And what does work? So it may seem a little funny that I am a hypnotherapist. I help people rapidly get over issues they're experiencing in life. I just posted a testimonial about a middle-aged man who had spent his entire life dealing with sexual dysfunction. One session and it worked. This book focuses more on young people though. I do see some teenagers sometimes, mostly adults, but it's really, really good because I am interested in sharing with people what is working, what's not working, and why it is, and also what's kind of happening in our culture because we are absolutely impacted by cultural memes, trends, things that get pushed on us. I mean, even just think about it. How often do you see ads for pharmaceuticals to help people shed weight? I think my husband and I just had a baseball game on or no, maybe it was tennis. Anyway, it was a massive sporting event and just seeing ads all over the place. So culture does impact what goes on with people's mental health. So I'm going to read directly from this book, which is amazing. I'm marking it all up. And one of the things that Abigail Shrier talks about is this treatment prevalence paradox. So this is the idea that we have so much treatment available, yet things don't seem to be getting better. Why is that? And I'm going to be reading directly from here. I said this in another video, but I'm quoting this from her book. Nearly 40% of the rising generation, so she's talking about Gen Z, has received treatment from a mental health professional. That is an extraordinarily high number, and that's compared to 20% of Gen X's, and more than 10% of American kids have an ADHD diagnosis. That's double the expectation for other countries. So something is going on clearly. So here's the paradox, the treatment prevalent paradox. So she talks about the fact that this began when soldiers returned home from the Second World War. And so obviously they'd experienced severely traumatic experiences being in a war. I couldn't even imagine. My grandfather was in World War II in a paratrooper at Normandy, and oh my gosh, the things that those people had to do and experience, I can't even imagine. But she talks about the fact that Congress, so she's referring to the U.S., so they greenlit a dramatic expanse in, quote, preventative therapeutic services, preventative. And so she makes the point here, no longer content to treat the ill, therapists became determined to support the healthy. And then she says between 1946 and 1960, membership in the American Psychological Association quadrupled. That's 14 years, so quadrupled. And then from 1970 to 1995, that number, again, of mental health professionals quadrupled. And then she says that in the U.S. since 1986, nearly every decade, they've seen a doubling expenditure on mental health over the one before. So here's the paradox. So it's an exponential expansion of treatments available, right? And the paradox is more widely available treatment ought to abate the rate and the severity of disease. So she says, take breast cancer, for example. It's a killer of 40,000 American women each year. So early detection and treatment has improved drastically since 1989. And then so those rates plummeted, right? With early detection and treatment, rates plummeted. So this is what you would hope to see if you have a dramatic increase in treatment available. She talks about maternal mortality, antibiotics became readily available, and rates of maternal death and childbirth collapsed. So here's the paradox. Yet, as treatments for anxiety and depression have become more sophisticated and more readily available, adolescent anxiety and depression have ballooned. So that is a cause for anybody with a curious mind would look at that and say, no, that doesn't measure up. That's something, she uses the word, I found something fishy in that fact, that more treatment has not resulted, in less depression. So there was a group of academic researchers who were noticing this as well, and they published a peer-reviewed paper titled More Treatment but No Less Depression, the Treatment Prevalent Paradox. So these authors note that, since the 1980s, treatment has been more available, and yet in not a single Western country has the treatment made a dent in the incidence of major depressive disorders. And in fact, many of these countries saw an increase. So she's quoting from the study in the book here, and I'm reading this now verbatim. Quote, "The increased availability of effective treatments should shorten depressive episodes, reduce relapses, and curtail recurrences. Combined, these treatment advances unequivocally should result in lower point prevalence estimates of depression. Have these reductions occurred? The empirical answer is clearly no." So she did the checking in and the research on several of the paper's authors. So too confirms that the same might be said for anxiety. Just think about it. How often have you personally maybe thought to yourself, this is anxiety, or I have anxiety, or has somebody in your family, in your work environment, how often do you hear that? Or it's pretty common. It's really, really common, this anxiety. So same thing goes. As treatment has become more widely available and dispersed, it's not going down. So she says, while the authors admit that there was likely more depression in the past than we realize, so things going undiagnosed, so that's definitely a factor that these authors of this paper are saying, they argue that there is at least as much and probably more depression now. So she goes on to say that, after generations of this increased intervention, that should not be the case. And instead, adolescent mental health has been in a steady decline. So a steady decline between 1990 and 2007. And then she puts even in here before teens had smartphones. And the number of mentally ill children rose 35-fold. So the proportion of adolescents between 15 and 19 who ended their existence, I'm not going to use the language here just because I think of the way the algorithms quote that. So that number has quadrupled between 1950 and 1988. So I don't know what the current numbers are. I'm going to guess that they're higher. And the New Yorker had reported that. So mental illness became the leading cause of disability in kids. But the coincidence is these two trends, right? This is the paradox. Deteriorating mental health in this era of more awareness, more detection, more diagnosis, and more treatment of psychological disorders. But that may be the coincidence here, right? It does not unveil a causal arrow. It's peculiar, and it may provide a clue. So what she's kind of getting to here is this clue, maybe many of the treatments and many of the helpers aren't actually helping. Hence the title of this book, Bad Therapy, Why the Young People Aren't Growing Up. Again, not an attack on all therapy. I do think there are types of therapy and therapists who are effective and who know how to really help people, and also know how to help clients access their what we'll call the psychological immune system. And so she also goes on to say that an associate professor of psychology at the State University of New York told the author of this book explicitly, and she wrote this in her book, the woman she's speaking to, this professor of psychology, quote, "No past American generation has faced a cumulative load of multiple simultaneous stressors today's emerging adults grew up with." So in this psychologist, this professor's book, she's saying therapists are helping young people, they insist, and that young people just simply face more challenges. So I talked about this, I pointed to this in one of the other videos that I did, but I wanted to focus in more in this video on, okay, what's this paradox? And also what some of the numbers are and some of the studies are saying behind it. This is really important. Why this is important for you or anybody is because look at the mental health decline of Gen Zers. I think that most of us, even those of us who don't have children, would say, we care what's happening with younger generations. Like, I also work with people around weight loss, and we're in an obesity epidemic as well too. That is absolutely undeniable in both Canada and the US. Mental health and obesity, they're definitely linked. But I think most of us do actually care what's happening with younger generations. And then also a lot of people spend a lot of time in therapy or and is it working? Is it not? How do you know? I did just post a testimonial from a client, like I referenced, who had this issue for many, many, many years. And he actually had a great therapist who finally said, hey, why don't you try hypnotherapy for that? I'm not saying this is the case in every case, but it's about what does that look like when you're in therapy? Do you find that you're going in and it's been a lot of years and a lot of weeks and nothing seems to really be getting better? She lays out kind of what the prescription for bad therapy is. And I'm going to go through each one of these points because it's so important. Because if your end goal is for kids to be healthy, for society to be healthy, for you to be healthy, to live a life where you're enjoying life, where you feel like you have some self-efficacy and control of your life and can actually deal with life, deal with the slings and arrows, not have a totally outrageous view on what life experience is like, that's good. That's really good. And I'm gonna go back to the weight loss example. People feeling really weakened and like they don't have the willpower, or because they've been overweight for so long, or because they would just prefer the comfort of the food, or because they just say, I don't do exercise or I don't do movement, are really letting themselves languish in a very, very unhealthy state. The same goes for our mind. So it is a perspective shift, a different way of thinking about things. And it could be important for you. You could have children, you could have nieces, you could have nephews, but certainly the health of an entire generation, it should be a concern, I think, for all of us. So anyway, I'm going to be on more with this book soon because it is fantastic. It is so rich. It's well researched. I think it's relevant to all of us, and I hope everyone's having a great day. Bye for now.